Okay, so magandang umaga po sa inyong lahat. This is another episode of the PCP Health Forum that we usually do every Tuesday. So sa mga nanonood po sa Facebook Live, good morning again. And then for our friends po sa press na online right now. Magandang umaga po. So ngayon naman po ang bibigyan natin ng pansin ay yung ating mga healthcare workers, no? Yung ating mga frontliners who are actually seeing the patients who have COVID-19. So madalas po nating pinag-uusapan kung ano ba yung mga kailangan gawin kung ikaw ay nagkasakit, ano yung kailangan mong iwasan para hindi magkaroon ng sakit at saka kung ano yung mga ginagawa no sa ngayon currently ng mga doktor natin at ng ating government sa mga pasyenteng may sakit. Pero nakakalimutan na kasi natin yung kapakanan ng mga healthcare workers. Sila po yung tumitingin, humaharap sa mga pasyenteng may COVID-19 at madalas po ay nagkakaroon din sila ng mga problema dahil hindi naman po sila superheroes, no? Tao lang din po sila, pwede rin po silang magkasakit. Pakinggan naman natin kung ano yung mga nararamdaman nila sa ngayon. No? As you would look at the title, ang title po ng ating health forum ay Frontline Handling of the COVID-19 Pandemic, a call for safety and security. So gusto po natin na yung ating mga healthcare workers ay ligtas sa kanilang araw-araw na gawain sa pagtingin sa ating mga COVID-19 patients dahil sila po ang importante, no? Sila yung nakaharap. Kung mababawasan po or maubos yung ating mga healthcare workers, wala na po tayong panlaban sa COVID-19. So, nais ko pong i-introduce yung ating unang speaker. Siya po ay isang internal medicine and infectious disease specialist. Active consultant po siya sa Calamba Medical Center, Westlake Medical Center, UniHealth Southwoods, and the Medical City in South Luzon. Siya po ay si Dr. Monica Pia Reyes Montesilio. Dr. Pia.
Hi, good morning, everyone. And thank you for giving me this opportunity to speak in behalf of the PSMIT. So it has been 4 months already, and healthcare workers start to burn out. Many healthcare workers get sick, and no life is worth 1 million pesos. We are not superheroes. We are not immune to the virus. As a matter of fact, many healthcare workers, like nurses, opt to resign because of the risks in their lives without proper compensation. Yes, it is our duty to take care of the sick, but we have lives and families of our own to protect. When we get infected, it should not always be blamed on breach on PPE protocols. Are PPEs provided appropriate and of good quality? We have been reusing, extending use, or improvising PPEs. Many private hospitals are on the verge of bankruptcy. In some provinces, there are only 1 or 2 IDS specialists, in others, none. We have felt the surge of cases the past month, and believe me when I say that lately, patients are more critical. Beyond the numbers and statistics, we see more morbidities and mortalities even among the young ones, and sometimes even among our colleagues in the medical field. And that's when it starts to become more personal. Aside from managing COVID patients, we continuously monitor the implementation of infection prevention and control measures in our institutions. We coordinate patients to the regional and city health surveillance units together with our infection control nurses, and we attend to numerous meetings with the hospital administration on how to better cater to our COVID-19 patients. The infectious diseases specialists, just like all frontliners, are spread out too thinly. This is not just about physical exhaustion. It also takes a toll on our emotional and psychological wellness. But let me affirm our commitment to serve as healthcare workers. We are one with the country in the fight against COVID-19. We call for solidarity of all stakeholders and the cooperation of each and every Filipino. The war against COVID is not just in the hospital level. It starts in each one of us, in each household, and in each community. Therefore, we appeal to the public, to strictly adhere to preventive measures such as physical distancing, hand hygiene, and wearing of masks and face shields. Cliche as it seems, but prevention is key to saving lives. Therefore, these are our recommendations. Can we show this slide? First, we urge local government units for intensified community interventions such as contact tracing and better referral systems. It's sad to see sick individuals, but it is tragic to see dying families. As the Department of Health reports that 99% of the 52,000 active cases are asymptomatic and mild, we request for expansion of community quarantine facilities for these patients to better allocate hospital beds to severe and critical patients. In terms of utilization of COVID-19 beds, it has been reported that only 50% of COVID-19 beds are occupied, yet major hospitals declared full capacity. We wonder why admissible patients hospital hop and have nowhere to go. We plead for a better system to identify which hospitals have vacancies to properly direct and coordinate patients to them. There might be beds available, but no nurses to take care of these patients. Let us not forget our non-COVID patients, those with chronic diseases such as cancer, diabetes, heart diseases, TB, HIV, to name a few. These patients have to be seen by doctors as well. We recommend to allot a safe space for them in each and every institution. Public health programs for TB, HIV, and vaccination have taken a back seat. These programs should resume activities to prevent additional catastrophic disease outbreaks. We implore for an increased supply of proper personal protective equipment and hospital supplies, such as high-flow nasal cannula and mechanical ventilators, access to drugs, including investigational drugs, and better manpower. Next slide, please. There is a high rate of resignation among nurses due to workload, inadequate rest, fear of getting COVID-19, difficulty in transportation, and inadequate pay, among others. More countries are hiring nurses from the Philippines, and these countries have relaxed their requirements for hiring. I believe our nurses want to serve our country, and we should take care of them. The welfare of all frontliners should be prioritized. Proper compensation and provision for housing should be provided. Acceptable nurse to patient ratio must be identified and practiced in order to provide quality patient care. And in order to serve our patients better and to sustain the operations of private hospitals, we request PhilHealth for detailed guidelines on the memorandum on the benefit packages for inpatients with COVID-19 and expansion of COVID case rates. Now more than ever, the PSMID together with PCP remain committed to serving the Filipino people, especially during this health emergency of international concern. And we remain dedicated to saving lives and reducing the burden of infectious diseases in the country. Thank you.
So for our next speaker, um, we'll be asking Dr. Monica Montesilio to please just stay online, no, para po sa mga questions natin sa kanya. So for those who have questions and if you are logged in via Zoom, please use the Q&A tab to enter your questions. At doon naman po sa mga naka-login ngayon sa Facebook Live, please enter your comments in the comment section, no, at kukunin po namin yon at itatanong natin mamaya. So ngayon naman po ay introduce natin yung ating second speaker, who is an assistant director at the Division of Nursing and Patient Care Services of Makati Medical Center. So katulad po ni Dr. Montesilio, siya po ay isa ring frontliner sa Makati Medical Center. Tawagin po natin si Daryl Jeremiah Gaba.
Hello, good morning po sa lahat. Can you hear me?
Yes.
Yes, I'm flashing my slides right now. This is gonna be like just 10 minutes. No. Okay. No. I'm one of the frontline support for nurses and a warrior too, like among others sa pandemic. No. And thank you, Doc. I'm privileged to be given the opportunity to speak in this forum today sa isang pambihirang oportunidad na ito. Hinihiling ko po sa lahat po na nakikinig at na nanonood sa inyo pong computers, no, na buksan po natin, ilaang buksan ang ating puso't isipan sa sitwasyon ng mga Filipino nurses natin ngayong COVID-19 pandemic. So this is just my disclosure. No, most of the photos here I got from Google and some from our stocks. Like what I mentioned in the press release quote, nurses comprise about 60 to 70% of healthcare manpower at any given organization. A crucial foundation kung iisipin po natin, especially these times of COVID-19 pandemic. Lahat ng healthcare workers sa pampubliko o pribadong pasilidad, their role is very critical in providing the patient needs. Una yung tinatawag nating exhaustion situation, ito yung punto ng kapaguran na meron po tayo ngayon. Discrimination at yung huli ay si cry for help na nagsisilbing boses po ng pagbabago. So every day, 6 months if we would count even yung February for some institutions. Since COVID-19 hit the Philippines, marami na po ang nagbago at napagdaanan ng bansa natin. Masasabi ko po sa sector natin, I think everyone would agree for all clinicians here na sa pangkalusugan, hindi po tayo tumigil at nagpahinga simula't simula. I can
Parang nawala si Mr. Gaban, no? So, Daryl, are you still online?
Hello? Hello?
Okay, naririnig ka namin. Okay, you can continue.
Okay, sorry. Um, I could remember no when, yeah. So thank you, Doc. I could remember when we were emptying those regular rooms and we converted them to COVID wings, no? And we admitted more and more suffering patients. Pero alam naman natin na may hangganan din. Kasi there are a lot of factors, no? Hindi lahat pwede nating mabigay in terms of manpower concerns, PPE, financial sustainability, and other non-COVID patients who are equally needing our help among others. But still, we all exerted effort to accomplish as much as we can, as far as resources can reach them. Minsan nakakasad din, or if you would remember, some of the beds we had to ironically reserve for our fellow frontliners who fall ill of the disease. Fast forward to today, no? In the WHO situation report given yesterday, the Philippines is actually second to China in number of total cases at 80,448, whereas China is at 87.
Mukhang nawala rin po si Daryl again. So if he's getting this, can we check again if he's back online? Baka,
Hello?
ayan, okay. Nadi-disconnect ka kasi. Can you use a secure connection?
Yes. Hello?
Hello,
Okay.
yes, we
I'll
can hear
continue.
you. You can continue.
Okay. So araw-araw hindi madaling maging isang frontliner no, during this pandemic. You need to master your bravery, risk your life for a highly infectious disease. Hindi po madali na lumayo sa bahay, sa mahal mo sa buhay kasi ayaw mo sila i-risk na mahawa ng isang invisible disease who only manifest the symptoms 4 to 5 days of an exposure. Mahirap mawalay sa mga pagkalingang pamilya, kaibigan, lalo na sa panahon nito na kailangan mo ng mental and social support. The only protection that keeps our healthcare army alive and safe are our PPEs, which you know is dwindling and kinukulang. Yung full gear na tinatawag natin like yung coveralls or yung gown kung tawagin, ilang patong po iyon aside sa mask na kailangan nating i-process, i-save, ulitin dahil kulang. Napakainit sa loob at at mahirap makahinga ng tama. But it is needed to keep you safe. Imagine how our nurses eating and just giving a few minutes for toilet break to remove it all first and put it back on. Madalas more than 8 hours na pagtitiis iyon ng gutom. Do you know it takes a short opportunity for the virus to penetrate the PPE if not worn properly or protocols on hand hygiene are missed? Bawat segundo ito ang takot ng mga nurses at frontliner. The fear is real. Transportation and lodging is a big problem as well. I remember during the first days of complete lockdown and public transportation was suspended. No? Yung team namin, we were all worried how our frontliners would come to work. As late as 2 a.m., we organized pick up for them with our personal cars. So mga 5 a.m. no, nung gumising ako to check who among our areas, no, within our area to adjacent city, who needs a ride to the hospital. It went on for a few days until we were finally able to provide contracted transport. There were times then na umuwi ang staff crying at the situation that they have to walk for miles just to go home. It's very disheartening. And even until now, it's availability versus safety no, in getting a ride. Lodging as well. Before we were able to get quarters, but as patients come in and scarcity and resources ng hospitals, we are so much struggling in finding the best options to assist our teams to nearby accommodations. Discrimination is another story which I'll talk about later. And now, imagine all that I have said, enlarge that to 6 months and experience the exhaustion of facilities, and more so the frontliner workers who still come every day to serve. But it's not the same. It's not the same as March or April. In terms of manpower shortage, we are seeing more resignations due to exhaustion, fear and burnout. Hindi ko din mabiblame mga families who ask them to resign no, due to health, safety, and survival. In fact, cross-infection of healthcare workers nowadays, you can still see before we have the fallen heroes. Right now, it's still rising because the increasing cases. And we've seen infection within the hospital coming from the community. Pero kailangan natin, di ba, sila, yung mga healthcare workers. We need the healthcare workers to be on their toes to serve the country. So what happens? So it's a funny story of getting them swabbed. Tapos pagkatapos pag negative, we ask them to report back. Just to share personally, no, during my first exposure in swab, as soon as I tested negative, I wanted to go back and help sa hospital. And then my family was so adamant of the stresses and fear that we have experienced. And all I can say to them was, if we do not do this, then no one will. So imagine the irony that every day we are at 1,500 to 2,000 new infected people. So that's increasing every day. But the question is, are we getting more nurses and doctors in the field every day as well? In fact, the manpower is being pushed to be decreasing with exhaustion and overall morale. There are beds in the hospital, yes, but are there enough workers to cover them? Moving on to my next slide, which is about discrimination. No? Just a short but meaningful message on healthcare worker discrimination. This happens every day, everywhere. Living spaces, side streets, and establishments You hear stories of dormitories denying healthcare workers, or worse, pinapaalis sila ng pag nalaman na sa hospital sila nag-work. We had a bad call, no, with me and my colleague, no, from a crying nurse who was sent away by her landlady. She lives in the province and does not know where to go. In the increased odds of getting next to someone with confirmed COVID due to the increased number these days, I would say it would even be safer in the hospital where protocols are in place than outside that you never know who tested, you never know who follows the rules, and you never know who is compliant with wearing masks, doing hand hygiene, and doing social distancing. What is the irony of that landlady eventually seeking help due to COVID infection? I just want to remind everyone in the community, in the public, that we are not the enemy. Frontliners need moral and emotional support, aside from essential needs such as food, water, shelter, and clothing. Discrimination is only fueled by fear and lack of compassion and understanding. This is not just our fight. You need to understand our role. What steps we do to protect ourselves, our loved ones, and even the community. You need to know your role too for being the bigger portion of the pie. We ask help, no? Finally, in my next slide, no, it's called a cry for help. Because finally, we urge the government to look beyond figures and listen to the cry and need of healthcare workers, especially the largest workforce, nurses. If we serve as a significant pillar of healthcare with majority being us in the front line, we cannot do this without your support. Appropriate compensation for nurses, assurance of PPE, to be tested when we are doubtful of our health, to have equal benefit from government support, and to be protected from discrimination. We raise our voice to our beloved community, the Filipino community, the public. We Filipino nurses serve our country every moment of anxiety, of fear, of hardship, of fits of hunger, of longing for our loved ones, and thinking of our own safety. For all that we have sacrificed, we ask that everyone does their part to be a solution and a support. To stay indoors when it's not necessarily, of course, to go out. To practice strict wearing of mask properly. And ironically, been seeing a group of people wearing their mask down together, drinking their milk tea and all. I mean, at least we observe what protocols we have placed not to increase the numbers, no? And from each other. When you get sick, you get heavily isolated, no? Let us think that COVID-19 is an isolating menace. Let us think of it. It keeps us away from our loved ones and from each other when we do social distancing. But the hardest part there is if you get infected, you'll be heavily isolated for weeks, up until the time of your death that not even a relative is nearby. Let us stop the numbers and control the rates. Choose not to add to the statistics. Call the attention of your neighbor and educate your loved ones. It is not just our battle, but everyone's. No? Nurses are already exhausted, like all other frontliners. And we long for the day that we too may smell the safe, fresh air. Remember us before you take off your mask or congregate in groups. Remember us when you are safe at home, when you have time to be with your loved ones, and when you can eat without fear of getting infected. Lastly, I want you to remember that every frontliner is a human being too, like nurses, doctors, and all healthcare workers, that we must also rescue. Yun lamang po. Thank you very much for giving me the time to speak.
So thank you po for Mr. Daryl Gaba, no? Nagpapasalamat din kami at nabigyan mo ng boses yung mga nurses who are working in the hospitals. And so narinig na po natin yung mga pangangailangan ng mga nurses, no? At yung mga recommendations ni Mr. Gaba kung ano ba yung pwede nating gawin para tulungan sila. Kung meron pa po kayong ibang mga katanungan, pwede po natin yan i-enter sa Q&A tab ng Zoom, or if you are on Facebook Live, then please enter it in the comment section. So Daryl will be available after our third speaker to answer all your questions. So yung atin naman pong pangatlong speaker ay isang doktor. Siya po ay isang second year resident sa Philippine General Hospital who is designated as one of the COVID centers. And he is also in the Department of Internal Medicine. So talagang frontliner po yun din yung ating third speaker dahil nakikita po niya yung patients na dumadating sa emergency room, na admit sa ICU, no, being in internal medicine. So nais ko pong ipakilala sa inyo si Dr. John Jefferson Besa.
Magandang umaga po. Ako po si JB Besa, isa po akong second year resident ng internal medicine sa PGH. Bilang pasimula po, ibabahagi ko po yung kwento ng isa po sa mga naging pasyente ko. Iibahin ko po yung ibang detalye para po sa confidentiality niya. Tawagin po natin siyang LM. Isa po siyang 60 anyos na lolo. Dinala po siya ng mga apo dahil 2 araw na po siyang nahihirapang huminga. Nagsimula po sa 1 linggong sipon, 5 araw na lagnat, 3 araw na ubo. Base po sa detalye ng kwento niya, sa kwento po ng mga apo niya, alam mo na sobrang mahal na mahal siya ng mga apo niya at sobrang inaalagaan siya. Pagdating niya po sa triage, naghihingalo, mababa ang oxygen. Kailangan na nating lagyan ng tubo. Yun po yung sabi ng mga doktor. Bilang mga apo na gustong mabuhay yung kanilang lolo, pumayag po sila. Gawin niyo po lahat para mabuhay ang lolo namin. Wala po siyang kahit anong sakit. Malakas po yan, lalaban po siya. Nang maipasok na po siya ng tuluyan sa ER, sunod-sunod na po yung mga pangyayari. Natubuhan, bumaba yung BP, nawala ng tibok ng puso, nag-code, nabuhay pero hindi bumalik yung kamalayan. GCS3, DESAT, ang pangit ng baga sa x-ray, mukha talagang COVID. Kailangan niyang makapasok sa ICU para mabigyan ng tamang atensyon. Pero walang bakante. Lahat ng naka-admit sa ICU, critical pa rin ang lagay. Hindi siya mabantayan ng maigi sa ER. Kulang ang nurses. Sabay-sabay dumadagsa yung mga pasyente. Pagod na yung mga doktor. Pagod na lahat. Tinawagan ko yung mga apo niya, in-update ko sa kalagayan ng kanilang lolo. At bilang doktor, tinapat ko na rin sila. Kritikal ang kalagayan ng lolo nila. Kailangan niyang ma-admit sa ICU at anumang sandali, pwedeng tumigil ulit yung tibok ng puso niya. Tuloy pa ba yung CPR kung sakali? Tuloy. Ilalaban daw nila. Makalipas ng ilang oras, lumabas yung resulta ng swab niya. Positive. Maya-maya, na-refer ulit si LM. Pababa ang O2 saturation niya. Naghihingalo. Pagdating ko, heart rate 0, BP 0. Nag-code kami. Tinapos namin ng 10 minuto para sa mga pasyenteng may COVID. Tinawagan ko ulit yung mga apo niya. Sa pinakakalmado at malumanay na boses, kinuwento ko yung mga nangyari. Iyak sali ng iyak. Lolo po ba talaga namin yan? Baka naman po nagkakamali lang kayo. Saan niya po makukuha yung COVID? Hindi nga namin po siya pinalalabas. Hindi ko alam yung isasagot, sa totoo lang. Mahirap ipaliwanag. Hindi po ba namin siya pwedeng makita talaga kahit po sa huling sandali? Mahal na mahal po namin yung lolo namin. Mahirap, masakit, at mas lalong hindi ko alam ang isasagot. Sa totoo lang naman po, wala naman pong mga bago sa ganitong mga pangyayari. Bago po ang pandemyang ito, umaapaw na po ang mga pasyente namin hanggang sa corridor. Maraming namamatay sa ER, hindi na nakakaabot sa ICU o ward. Kulang na kulang ang nurses at mga doktor. Ilang dekada na kaming ganito. Siguro po nasanay na ang PGH. Kinakaya na lang ng PGH. Pero yun nga yung masakit. Nasanay, kinakaya. Siguro tama na. The current crisis has exposed how weak our health system is, crumbling at the very core, with the healthcare workers from the far-flung barrios, the largest hospitals, and our patients at the losing end. Yesterday, we have seen our state of the nation, but I would like to believe that what we are fighting for now is the real state of the nation. The mediocre response of our government, underpaid and overworked healthcare workers who are getting sick as I speak, a nonchalant attitude, the gravity of the current crisis, as if numbers are not actual lives. We don't deserve this. the Filipino nation deserves better. In behalf of the healthcare workers you treat as dispensable soldiers in a war where we are nowhere winning, we demand a robust response and accountability from the government. Number one, augment manpower. Increasing the number of beds for COVID patients must be matched with an increase in number of healthcare workers. Number two, increase support for healthcare workers. Properly compensate us. Provide us with sufficient PPEs. Marami na po ang nag-positive sa aming mga kasamahan at may mga namayapa na po habang naglilingkod. Stop labeling us as heroes if you treat us as dispensable. Number three, expand quarantine facilities to accommodate asymptomatic and mild COVID patients. Unload your COVID referral centers to allow them to help more critical ones. Number four and last, fix the referral system among communities and hospitals. I know this is a challenge because of our devolved health system, but we have to make it work. Fix the leaky faucet at the community level. They are equally, if not more important, frontliners. Empower the community, and we must mobilize everyone. All hands must be on deck. COVID-19 should be our number one priority and not other issues. We must acknowledge the gravity of the issue, admit that we have failed to respond quickly and appropriately. Halos 5 buwan na po na meron po tayong ganitong pandemya, pero para po mas malala yung sitwasyon kumpara noong nagsimula tayo. Pagod na po kami at alam kong pagod na rin po kayo. Marami na pong buhay ang nawala at hindi po kami papayag na ang isang apo o anak ang mawawalan pa ulit ng lolo, lola, nanay o tatay. Hindi na po kami pwedeng manahimik na lang. Kailangan nyo na po makinig sa amin. Salamat po.
So thank you, Dr. Besa. I'd like to request the IT to please to please show all the panelists para po sa ating Q&A. Pwede po nating ipakita yung yung mga panelists. Okay, so maybe you can show the screen of all 3 speakers, no, para para the questions can be asked. Okay, so I have a question here for Dr. Montesilio. May nagtanong dito, one of the panelists, what is the stand of PISMID on the use of remdesivir and favipiravir?
Okay. So nakasaad po dun sa PISMID guidelines namin that yung evidence po in the use of this specific therapies against SARS-CoV-2 is currently limited. So yung core ng management po talaga still remains to be supportive and intensive respiratory management. So yung paggamit po ng remdesivir and favipiravir may be considered in the setting of clinical trials for hospitalized patients or for compassionate use. So insufficient pa po yung data to recommend the routine use of these drugs for patients.
Okay, thank you, Dr. Montesilio. May question naman dito, no? Siguro sa iyo ko na rin itatanong dahil ikaw yung consultant. I think this question is addressed to PCP. What are your comments, or are you amenable for our medical residents after going on duty to go with quarantine protocols like 3 days duty, then 5 days off, or longer if with sufficient manpower? And then that also includes yung nurses daw. So maybe we can ask Dari later kung ano ba yung magandang duty schedule na pwede niyang ma-suggest for nurses.
Kung sufficient po yung manpower, sure, para everyone can rest well. And again, like what I said earlier, this is not just about physical exhaustion. It takes a toll dun sa ating emotional and psychological wellness din. But again, one of the problems talaga is manpower across all levels of the healthcare system. But if it's possible to do quarantine for some days, that will be very helpful. Pagdating po sa amin kasing mga IDS consultants, especially like me, na I practice actually in 6 private hospitals here in Laguna, and we are very few. So, wala pong pahinga doon. Kahit Sunday, I have 60 to 70 private patients. So, I don't have rest. Hindi ako pwedeng magpa-relieve. Wala kaming group practice dito kasi sobrang konti lang po namin. Walang enough sleep kasi sa gabi tatawagan ka for new referrals, admissions, or isa or dalawang patients mo dying. So, kung sa residents, sa nurses, pwedeng makapagpahinga sila ng mabuti, go tayo dyan.
Okay, yung tanong kasi dito, may isang question no, kung amenable ba daw sa mga residents. So, do you have residents in your institutions?
No, I don't have residents or fellows in any of my private hospitals here. So, it's really me.
Okay. So, depende naman din talaga yung situation. No? Pero I think dapat din tingnan natin yung, siguro we can ask Dr. Besa, kasi yung question dito for the residents. No? So, do you feel that your institution should be amenable regarding your situation? Ano ba yung feeling mo na dapat gawin no para mapangalagaan kayong mabuti bilang frontliners and you are under training, but actually you are resident in training pero meron ka namang salary, di ba? So you are considered as an employee also of the hospital. So you have benefits, you have salaries. Kasi gusto ko lang din ipakita yung situation na kahit trainee kasi yung doktor, employee pa rin siya, no? Worker siya. Hindi siguro kagaya ng mga students like interns and clerks na hindi naman sila ngayon allowed no sa hospital. I think yun na talagang inaalagaan naman natin sila ng mabuti. But you as an employee, nabanggit mo yung mga kulang. So ano ba yung feeling mong pwedeng baguhin or may kailangan bang gawin sa duty schedule ninyo, or are there enough residents right now? Baka naman hirap na din kayo.
First of all, definitely po, importante po talaga yung rest kasi this is more than just physical exhaustion. So yung pagsusuot po ng PPE, I would understand, especially for our first years and third years who are on the COVID wards talaga na donning for 8 hours, they need rest after. And a 1 week on, 1 week off schedule is doing well, not only for our physical health, but also for our mental health to process everything that we encounter in the ward. Kung kaya po talaga ng manpower, why not? Sure. Pero ako po personally, actually we were asked by our department if we would like to take a leave, for example, that alternating kami, we go on leave for a week. But kung mahihirapan lang din po kasi yung mga maiiwan sa hospital for our sake na mag-leave kami, I'm personally a little hesitant po kung tatanggapin ko ba talaga yung leave, because I would want, personally, I would want us to be in this together na sama-sama kami. Pero kung yun nga po, kung kaya naman talaga ng manpower, sure, we will take the leave naman po. What the hospital can do po is, again, provide sufficient PPEs, ensure a good supply chain, duty schedules po na okay naman, na hindi naman na nakaka-over-exhaust for a resident. Definitely po, we are welcoming more manpower kasi sobrang dami po talagang pasyente sa ward, and of course with more manpower, mas mag-i-improve yung quality ng care na binibigay namin sa patient. So kailangan po talaga ng more manpower, especially sa PGH.
Okay, thank you. Itong question naman na ito ay for Mr. Daryl Gaba. So, ano yung comment mo kanina, no? Nabanggit kasi yung mga nurses. Ano ba yung magandang schedule na nakikita mo na posibleng pwedeng um, gawin, no, for the nursing staff? And then, siguro idagdag ko na rin yung isang question dito. With the manpower shortage, would you still encourage non-hospital practicing nurses na magbalik loob sa hospital? And then how would you encourage them, no, given that there is a pandemic? Thank you.
Yeah, thank you, Doc. No? Sa first question about the schedule, since the pandemic started during March and April, we designed a schedule for them na meron silang a week on and a week off. No? So ibig sabihin, as much as we can, if we can provide 5 days or 4 days or 5 days na off after like 4 days na naka-on duty sila or 3 days na on duty sila, we do that for them. That's something na we think na they would be able to rest more. Pero sabi nga ni Doktor kanina, malaking factor dito if you have staff to pwede mong balasahin no? Kasi right now, as more patients come in, the demand for more manpower is there. And of course, kung minsan inisip mo, gusto mo na lang magkaroon na biglang may tatayo ng staff dyan sa harapan mo, pero no. But you have to balance it with the schedule na they will be able to rest well. Kasi ang mahihirapan ka is when you lose sight of their schedule, pagtingin mo, mawawala na yung most of them because of exhaustion or resignations. No? The best would be providing a schedule for them na meron silang way, number one, for them to choose an option. So if they would be wanting a schedule that is 8-hour shift or 12-hour shift, you give them the leeway for them to decide. And then kung meron tayong paraan para meron silang more days ng rest, then that is very much better. That is much better for them, no? Kasi makapagpahinga sila, and that is coupled with if you would be able to in your organization, no, get accommodation or transportation services para they can go to the hospital soonest, go home after the work or go to the hospital soonest na pagpapasok sila, no, para wala silang meron silang enough time even to rest in between their duties. And then for the next question was about yung sa nurses coming not working before sa industry. We've been opening application not just for new hire but even for those na you'd be surprised merong umuwi ng Philippines from before COVID and just wanted to rest but now wanted to pitch in. There are those na nag-resign pero since waiting for pag-alis nila would want to go back sa hospital kasi gusto nilang tulungan yung mga colleagues nila at hindi pa naman sila makaalis. And even those na hindi nag-practice but are RNs, licensed RN, are doing something else, there's a way for our human resource to give them compensation based on their experience, but still, of course, we have to train them on elements that they need to be reinforced, no, when it comes to their education and training, no. There's this way na meron kaming Viber group per batch of newbies, no? And I happen to read one na meron siya na nagbalik loob siya sa practice ng nursing after a long time and helping out gives him the satisfaction na he was able to pitch in during this very trying times, no? And he was able to recognize na hindi siya nagkamali sa profession na pagiging nurse. And those are the opportunities that give us edge to give support sa mga nurses namin na napapagod na and would need backup, no? Kasi I think naman schools would we would understand schools if there would be any graduates or even those taking board exams right away to fill in the slots. But whatever professionals we have on hand in the country right now who are well and able that would like to help the frontliners and relieve those who are already working so direly for the past months, they're more than open to choose a hospital and be educated and be compensated and go back to practice. So I think that's my answer, Doctor.
Okay, so how do you handle naman, Daryl, no, yung mga employees or nurses who refuse to work in COVID wards due to fear or for whatever reason that they have? I'm not sure if you are a nurse manager, no? Pero paano kung halimbawa yung nurse na under you mag-refuse mag-work? How do you manage them? And there's another question here that I don't know how to answer, no, or look at. Pero tinanong if you see the role of nurses to be evolving considering the challenges they face and as they are affected by the pandemic. So, Daryl, narinig mo ba yung question? Okay, siguro we'll proceed to ask the questions for Dr. Montesilio first, no, while waiting for Daryl to be online. Um, is it true, Dr. Montesilio, that one of the studies show IgG antibodies for COVID-19 disappear after 20 to 25 days?
Um, Actually, we have very limited data yet on the immunology and virology of the SARS-CoV-2. That's why it's very hard to give recommendations on the use of these antibody testing. So we don't have concrete answer yet on how long or even on when these antibodies, both IgM and IgG, will start to appear, or and how long they will last in our bodies. So no, because we know very little about this novel coronavirus, we don't have sufficient data yet to answer that question.
Okay, thank you. Now, I'd like to ask your recommendation naman, no? May nagtanong kasi dito, ano ba daw yung nakalagay doon sa PhilHealth that we want to be more specific about? Kung ano ba daw yung kulang. And then, may question rin regarding some healthcare workers are not subjecting themselves to COVID testing, hence putting their patient at risk. So is it possible to require clinicians and their secretaries to do testing? And is it possible to make the COVID tests or swab tests free or at a discounted cost? So kasi parang feeling ko related ito sa healthcare workers benefit.
Mhm. So first, about the PhilHealth COVID packages, the PCP already requested for a private meeting with PhilHealth, because we are requesting for clearer and more detailed guidelines on the circular number 2020-0009. But just to give some examples, since private hospitals have no funding, then we want to know on whether the hospital bill, if the hospital bill will exceed the package rate, will PhilHealth cover for that? And if it will be sustainable. We also want to get more details with regards to the percentage on how much the hospital will get and how much the doctor will get from the packages. Although again, it's not good to be talking about professional fees at this time of the pandemic, but the doctors want to get commensurate compensation for all physicians handling the COVID cases. So those are just some of the things that we want to clear with PhilHealth, but I think that should be discussed privately with them. Now, with regards to the testing of healthcare workers, yes, we should definitely expand testing for healthcare workers, and they should definitely be free for all frontliners, especially the healthcare workers. So, if it's possible, like with the other institutions with who has their own molecular laboratories, they really do routine regular testing on their healthcare workers, but in other hospitals like the smaller ones, especially the ones in the provinces, we don't actually get to test ourselves and the other healthcare workers.
Okay, thank you, Dr. Montesilio. This question I'd like to ask you, but also I'd like to request Dr. Besa to answer as well. No? The question here is it safe to get care for any other medical conditions during this time? So, kumbaga non-COVID yung mga sakit. So, I mean, how would you advise these patients to go about with their consultations? Kung wala naman silang COVID, baka natatakot silang pumunta. Pero pag magantay naman tayo ng emergency na, baka lalo naman di sila ma-accommodate or they might not get well. So, what are your recommendations for these types of patients?
Okay, so I think that's one of the recommendations in my slides po, no? We should not forget about this non-COVID patient. So the healthcare institution, it's difficult po kasi to say or to designate one hospital na sabihin natin na ito lahat ng non-COVID patient pupunta sila dito. It's hard to say that because nowadays the clinical presentation of the patients are different, they're very varied, and sometimes actually patients have no symptoms at all. So dito po pumapasok yung mga telemedicine, teleconsultation, if possible, and each healthcare institution should make sure that they have proper triaging, they allocate areas where these patients can be seen, especially the patients with chronic diseases who are immunocompromised, like patients with diabetes, CKD, TB, HIV. So it really takes not just in the hospital level, dapat sa community level, kung kayang ma-assist na sila kung saan sila pupunta. And yung sa hospital level, i-assure natin na meron tayong safe place for these patients.
So thank you Dr. Montesilio. So very nice recommendations no na sana hindi lang sa hospital merong triaging or assistance kahit man lang sa community level meron ng parang triaging no na gano'n. And of course in the hospital dapat wag nating kalimutan na meron din naman tayong other patients hindi lang COVID patients. So that's a recommendation from a consultant who is seeing COVID and non-COVID patients in their center. But what about kay Dr. Besa naman? Yung question kasi, you are in a hospital that sees COVID patients only. Ang daming pasyente ng PGH na iba't iba yung sakit. So, ano yung parang proposal mo or nakikita mo na solusyon para hindi naman mapabayaan yung mga taong ganito na dati pumupunta sa PGH dahil sa sakit nila pero ayaw nang pumunta kasi nga COVID center na tsaka baka hindi rin naman sila tatanggapin.
Sir, to clarify lang din po, PGH is still accommodating to non-COVID patients. We have separate wards that we first, when a patient is admitted at the ER, sinisigurado po namin na meron silang swab. Then kapag nag-negative na po, we transfer them to non-COVID areas. So PGH still caters to both COVID and non-COVID. Medyo to a lesser degree na nga lang po yung non-COVID compared to before this pandemic happened. So I agree po with Dr. Montesilio na we should maximize telemed. So ngayon po, yung OPD po namin is operating po on a telemed basis. Sobrang konti lang ng slots. But I think with the current situation, it's the best that we can do para hindi po natin mapabayaan yung mga patients na nagpa-follow up sa atin at yung mga nagko-consulta po sa atin as new. But I would recommend po at for PGH po na ginagawa naman namin na we have strict protocols of PPE per area to prevent cross-contamination because we don't want our non-COVID patients to get COVID while inside the hospital. And I also recommend po na we should really mobilize other hospitals. Marami pong ibang hospital bukod sa PGH. We have various local hospitals, health centers that could probably give better care kasi po sa telemed, admittedly, very limited po yung pwede naming magawang examination to the patient. We cannot do physical examination. We can only surmise kung ano po yung meron yung patient. So the best care can be given po dun sa mga nakakita sa kanila, which is mas maganda po talaga yung mga malalapit sa kanilang health centers or yung mga local hospitals. So I would suggest po to these kinds of patients needing urgent care na pumunta po doon sa pinakamalapit na pagamutan sa kanila. And I would also say na yun po yung mga nagawa ng PGH to actually parang keep up with the demands of this pandemic. So yun.
Thank you. Now I see Daryl na he's back online, no? So, Daryl, baka pwede mo nang masagot yung mga questions kanina.
Yeah, sorry for the bad connection. No? I think the last question I heard before I went offline was yung um, what if nurses would not want to work in COVID areas? Is that it?
Yes, yes.
Yeah, of course, I think at some point, no, lahat ng hospitals would have experienced that, and of course, that's not new to us. Pag yung staff naman, hindi naman din niya gusto mag-work sa COVID areas, hindi naman namin yung kailangan pilitin. Kasi of course, may ibang staff, of course, kailangan naman natin i-prime ahead, no? For them to be able to prepare themselves emotionally and socially, emotionally and psychologically before they work in the COVID area. Hindi yan yung duty mo na gusto mo kaagad, doon mo kaagad siya i-float. Not unless yung batang yon o yung nurse na yon have already worked in the COVID area before. Now, one of the strategy of one of the assistant directors nung sa general nursing namin was quite effective. No, what they did is that yung mga nurses would tend to agree more in working in COVID wards if they will be assigned there with their colleagues. Kung saan sila, for example, you have to pull out nurses from this medical unit. Sabihin natin medical unit 1. If we tend to pull just one nurse there, and you'd have more doubts of them agreeing to be working in COVID wards than if you would transfer like 4 of them as a group, as a whole team, that they could work together and be assigned. We'll be having waves of teams having their duties in the COVID areas. And for some time, of course, meron din naman mga hindi mag-agree na mag-work. Hindi naman natin mapipilit yun, even for those na nagre-resign because of the safety issues when it comes to hazards in working in the hospital per se. No, we just have to make it a good, provide a good support for them in terms of PPE. Kasi pag assign na lang natin sila, at least the best we can do is provide them with enough PPE, to provide them with enough emotional and psychological support after. Hindi yun sasabihin mo lang na assign mo sila doon, but syempre it's a matter of maraming kausap yan with people, no? At sa panahon na ngayon, hindi lang to like it's a matter of directive, but a matter of working together, no? And it's true, bottom line, we've been seeing that, but so far there have been more determined people who would actually answer the call of duty.
Okay, there is another question here, no, that I would like to ask you. Actually, talaga namang nakadirect din siya sa'yo. To Nurse Daryl, what is your comment on the DBM budget circular number 2020-4 on increasing the salary grades for entry nurses but not for current nurses? And then there's another question here also asking about the hazard pay for doctors and nurses, if you're familiar with it.
I think the pay for nurses and the hazard pay would have been a long-standing issue and debate for even before COVID, no. But it's more highlighted right now. Ironically, ngayong panahon ng COVID, 2020 is also the year of the nurse, but based on World Health Organization, the year of the nurse and the midwife, no. And we are seeing much regard for value of nurses in terms of their input during this pandemic. And I think it is just fitting for nurses, likewise with other healthcare professionals na nasa frontline ngayon and braving all these perils to be compensated well, no? It's a very tricky answer, no? When we talk about implementing it right now, because it's easier said than done. But as much as it's supposed to be slowly considered and slowly but much considered, no, by organizations, but mostly even for government to provide opportunities for organizations to implement those things. Kasi even looking in the level of management, no, hindi naman siguro pag similing tayo, they can provide as well, because if we cannot sustain the whole organization, everything will crumble down. But nonetheless, we do not want to disregard na importante din na ma-compensate natin ng tama yung mga nurses natin. And that is something we had to work on continuously. I just don't disagree na siguro this yung mga existing would not have an effect for them, but it should be affected across kasi the way that you term it as compensation, the basic principle that it is being termed compensate is to give value to what value is given by their profession or their output, no? And if it cannot be rolled out right away as much as possible, it should be started soonest, no? Kasi these are people more than ever have been showing their dedication and bravery to take on the duties of being frontliners, going away from their families and taking all these hazards. In terms of hazard pay naman, I think that's also commensurate with compensation. Those who are able to do so, I'm happy na may ibang organizations have a way of providing hazards. For other organizations, they're doing hazard assistance in different levels, not just the pay. No, it depends on the ability of the organizations, but nonetheless, it should be always considered to be a part of crucial and important way of valuing the workforce, which are the nurses. So, in whatever way they can, it should be part of their consideration. And I'm happy na in our organization we have a top management team that always have a regard for nurses, and I think all organizations should be working at their best if to give a compromise of how far we can give, no, as much as we can for acknowledging nurses and for the compensating them for the hard work that they've given.
There's a question here naman, no, regarding the call of the DOH for hiring healthcare workers, no. Siguro I know you work in a private hospital, pero nakikita mo ba na kapag let's say may attrition, I'm sure, no, may mga nurses na nag-resign and you are hiring, kumukonti ba yung applicants unlike before? Do you see that they are afraid maybe of working because of the COVID-19 threat?
In terms of applicants, no, well, that can be said that it's not the same as the applicants before. One thing for sure, yung if you have new hire before, newly graduated professionals who just took the licensure exam, that will be off the consideration kasi hindi naman marami ngayon nang nag-graduate ng nursing considering when we started the pandemic and even taking up the board exam. But in terms of those who are, surprisingly, we have applicants na have been RNs before, and I would say there's a steady number of them applying for hospitals. There's a number of them, mostly those who are experienced, who want to go back and contribute, and those who are have an opportunity na bumalik dun sa profession ng nursing, no. It's just a matter of right now, the reality is if they have a choice of hospital to go to. Kasi with them being a good commodity, the reality, be it difficult to say, no, which hospital provides the best support, if not just compensation. But kasi yung compensation, you could spend the money easily, but when you talk about benefits, it's who will give you the tell you the, oh sige, if you feel symptom, I'll just test you now, versus someone who, you know, will give you so much big compensation, but nonetheless you pay for your own test. I think it's just that the applicants now have more voice on which hospital to choose from to take care of them, which is that urges all organizations and even the government to help enable these institutions to provide the support that these professionals are not just asking because they wanted it, but because this is something of basic necessity, not just of food, shelter, and clothing, but of safety and security. No? And I would say with your question, it's a fair volume. It's not as many as before, but you'll be surprised there's a fair volume of them. Only that they would have a more say of where to go than before, that the top hospitals would have to get them the cream of the crops, no?
Okay, thank you. So I think klaro naman nakikita natin no yung healthcare workers like you, the nurses, and then our doctors here, Dr. Besa and Dr. Montecillo, are clearly committed pa rin to serve no in spite of the pandemic no also and the COVID-19 affecting our colleagues na kahit healthcare workers nagkakasakit din. Pero syempre kailangan din naman tingnan yung mga pangangailangan ng mga healthcare workers no hindi lang syempre ang hirap na like dapat maintindihan ng iba na willing nga tayong magbayad ng sobra ng konti para for example when we order something pinadala mo sa Grab no may konting dagdag so maintindihan din natin that the healthcare workers also need more attention at this time more compensation it's not about the money pero yung sinasabi mo nga kung ano yung service na binigay mo syempre tutumbasan mo rin lahat naman tayo sumusweldo so sa ganitong mas nahihirapan, edi dapat mas mataas din no, yung compensation. There's a question here for Dr. Besa. This is regarding postgraduate interns. So would you recommend our incoming PGIs to already start their face-to-face internship to aid in the lack of manpower? And then how can we ensure safety or do you have recommendations regarding the schedule, provision of PPEs, how about for the clerk? So I think na-mention mo naman to before na kailangan ng when you put people on duty, dapat may adequate PPE, no? And then a proper scheduling. But maybe yung deployment ng postgraduate interns, what is your idea on this?
First off, short answer, I would not personally recommend them going to the hospital. At least in PGH, we have documented actually more healthcare workers being infected in non-COVID areas. So at the very least, if we will call them back to a face-to-face internship, lalagay natin sila sa non-COVID. But actually, mas mataas yung rate ng mga nai-infect na healthcare workers sa non-COVID. So no, I would not want to risk our future doctors and make them feel na they are just manpower, they are dispensable. So no, I would not recommend. Another issue is, yes, our institution is promising na we will provide sufficient PPEs, but I don't know kung hanggang kailan yung tatagal kasi alam naman natin na finite yung supply chain. But of course, if ever lang nababalik talaga sila, we have to provide them with enough PPEs. No PPE, no duty dapat talaga. And for the clerks, similar situation. More so for clerks, they are considered medical students na they do not have an oath na sinumpaan to be for the service of the underserved. So definitely with the current situation, with the current trend, I would not recommend going recruiting back clerks or interns in the hospital.
Okay, thank you, Dr. Besa. I have another question for you, no. And then after you, I would like also Mr. Gaba and then followed by Dr. Montecillo to answer. So may question dito na to everyone. No? Pag pinapakinggan daw yung press conference ng pamahalaan, everything is okay. We are dealing with the virus just fine. Marami tayong PPE, we can test millions. But in the front lines, no, in your own experience, ano ba talaga ang palagay ninyo yung estado ng ating pagtugon sa COVID-19?
First, ano ba? Sobrang kulang na kulang. If I would give a grade or a score to the current response of our whole government, sobrang bagsak. I mean, as I have mentioned earlier, in the front lines, we are seeing that we are worse kung kailan tayo nagsimula. For me, I see it na parang we delayed the progression, but parang we are heading towards the same direction after all. We are seeing more intubated patients, more patients na kailangan ng ICU admission that we did not see at the start. Well, to be fair to the government, the lockdown worked, probably albeit medyo late, pero it worked. Pero nung nilift na yung quarantine, mas dumami na yung cases, and yes, sige nga, marami tayong natetest, ganyan. But then, yung mga quarantine facilities, yung contact tracing, kulang pa rin eh. Natetest nga natin, oo, alam natin, pero ano yung susunod na step? So, I think, hindi yung sinasabi sa news ng mga numbers, technically yung iba doon totoo pero you can kasi parang handpick the data and make it appear na okay tayo, but I am telling everyone na in the front lines hindi talaga okay. Sobrang mas malala tayo kumpara nung una.
Daryl?
Yeah, Doc, no. Actually sa team namin sa nursing, no, I would always be the one waiting for their statistics every day and forwarding it to everyone, no, saying, oh, ito na tayo today, this is our census, no. And in fact, every day I would always go to the computer and look at not just World Health but also tracker for DOH. If it depends on the people looking at it, no. If you would say that it is we are doing good, which is doing good sometimes, it's a good way for us to be encouraged, but sometimes it gives us a good way for complacency. And even for the facts, alam naman natin the facts would always give us the true picture. Pero these things like yung session natin, I like to congratulate yung team that has organized this forum, no. You see the stories and the realities behind the numbers, the everyday things that happen, that would sometimes be more meaningful than the digits that comes after the fact na these numbers already have shown after they've yielded already how many recovered or how many been tested, but not on an everyday basis when it is still being cooked, no? When it's still being decided upon. Ngayon, when we talk about the raw numbers of ilan ang positivity rate natin, it's good and it's encouraging, but the challenge for us is sometimes the problem is sustaining what we have already started. And it's a good deal also of discipline. Kasi the numbers can't work by itself na bukas pag gumising tayo, mag-i-improve siya ng sarili niya. Kasi people will still decide, the public will still decide who will turn out to be the next positive patient. And healthcare workers and facilities would be the plate where they would all converge in when they tend to realize, dapat pala hindi ko ginawa yon. And then all of them coming in increasing the number. No? I think when we are given opportunities, for example, to relax lockdowns, we should have also a back end or a standby strategy for making sure that in the event that people will turn out to be positive, and we know the spread is quite fast, no? It should be looked upon and strategies are in place before the actual lifting. That's just my opinion. No? Don't run after me for that. But it's just my insight na siguro when we decide on certain things, we should be able to cover a lot of scenarios that would come up with that decision, and to anticipate where patients would be coming in in case they flood in, considering the lockdown has been lifted. No, what reminders need to be reinforced more to exceed even the gusto of the public to go outside, versus just to the services are there for them to be catered. However, if they don't need it, they should not be outside. No. What reminders are in place, and how creative are we in getting them reach to the public themselves? And I think the real deal here is it does not really start and end with healthcare providers who turns out carry the whole burden of all of it. No, it's a good direction from government, but everyone must take their part of how they would able to initiate project or steps to improve even in their own community, even sa community na lang nila, sa village nila, sa city nila. What steps they can start, not waiting for the government or healthcare organizations to prevent the spread, and even look for areas na pwedeng admitan ng mga patients natin. That's just for me, Doc.
Okay, thank you. Dr. Montesilio.
Yeah, I agree with both Dr. Bessa and Daryl. We are not okay. We are diagnosing more patients, but we are more relaxed. We have been lifting the community quarantine protocols, and the implementations, I think, are more relaxed. We lack PPEs during the start of the pandemic. We have been receiving donations from the private sectors, but now I think the private sectors are also depleted already. We are in a more severe situation again, like what I mentioned earlier. We are seeing more severe cases. The reality is lahat ng tao sa front line pagod na. It's like we have accepted that this virus is already part of the new normal, that we have to live with this virus. So it really takes the different sectors, the different stakeholders, and it calls for it's a time, like what Dr. Alejandria, the president of PSMID, said. This is a time to revise or revisit the health reforms.
Thank you, no? So, sabi nga dito, isang comment ni Dr. Limpin, meron na daw donor fatigue. So, may doctor fatigue na, meron pa ring donor fatigue. So, syempre, ayaw naman nating ma-overwhelm yung ating system. So, just a few questions for Dr. Montecillo before we close, pero I'd like to ask both Daryl and Dr. Bessa to prepare your parang closing statement, no? Or parang key points that you would want to tell the public as we end this forum. So we will probably end at around 11:30. So Dr. Montecillo, yung questions dito regarding the COVID, regarding the disease, no? So how do we go about identifying asymptomatic carriers in the hospital, especially those in the OPD, and if there is already immunity derived after recovery from COVID, kasi marami daw mga reinfection among residents and nurses. And I think also we heard in the news that si Senator Zubiri was also reinfected. And then we have a doctor admitted who has been reinfected as well. So any maybe updates regarding reinfection?
Like almost all things with regards to this SARS-CoV-2, we have limited data with regards to reinfection, again because we have little knowledge and concrete evidence with regards to the virology and immunology of the disease. So it's very hard to give recommendations, concrete recommendations on whether there are really reinfection. As we get new evidences, we have new recommendations. So I think that's one of the things that is scary about this, is because we know very little about this, and it seems like there are many pictures of this virus. With regards to patients, like asymptomatic patients who come in the hospital, that is very possible, but it is impossible to screen everyone. If we can only screen everyone, but again, the RT-PCR will only tell us if this patient is infected at that moment in time. This patient can be RT-PCR negative today, but tomorrow this patient can get infected. So some say that you just assume that everyone is an asymptomatic carrier. That's why we have to protect ourselves and we have to respect others by doing these preventive measures.
Okay, so tama naman, no? Identifying asymptomatic carriers, of course you will have to swab them, no? Kasi hindi mo naman malalaman kung may sakit talaga sila o wala. And if you act like you yourself, you're asymptomatic, that you may be a carrier, then maybe you will not transmit it to anyone, no? So hindi ka makakahawa. There's a question here naman regarding government policy kasi we know that the DOH protocol does not recommend rapid antibody testing, no? And then, ang ano kasi dito, bakit daw kahit na hindi siya nire-recommend ng DOH, some LGUs and big companies still do this, no? Do you have any idea or any comment as an infectious disease expert?
Okay, the WHO, CDC, IDSA, and PISMID do not recommend doing the rapid testing. Again, on the basis of no concrete evidence and knowledge on the immunology and virology of this disease. Also because we have no kits that is, so they may be FDA approved, but they are not validated by RITM or the OST. These kits have different sensitivities and specificities. They have cross-reactivities. So in our society, we don't recommend the use of this rapid antibody test for diagnosing and screening people. So we still do the RT-PCR for that's still the way to confirm the disease. So, but we understand that there is rampant use of this rapid antibody tests in the grassroots level, in different companies. I don't know yet on how we can control. But definitely, if someone presents with a symptom, then they should not undergo a rapid antibody test. They should be swabbed. Because this rapid antibody test can actually give a false sense of security that you don't have the disease. So again, it goes back to the very basic of preventive measures.
Thank you. So talagang importante naman talaga yung preventive measures that everyone should really follow, no? Kasi tama nga yung nabanggit nyo kanina na nagre-relax na yung mga tao, no? Hindi na nila iniisip, akala nila wala ng COVID. Pero actually nandyan pa rin. But what about for those naman who tested positive on RT-PCR? There's a guideline released by the DOH that they don't need to undergo repeat test again, but just isolate and complete the 14 days of quarantine and then send home provided that they are asymptomatic.
So that's really true. We can really do that because studies have shown that from the time you were infected up to around day 10 to 11, the viral load really decreases. So the priority should be that because of limited testing, our priority should be using the RT-PCR to diagnose patients so that we can implement transmission-based protocols. So not really on using it for recovery or as a criteria for discharge of hospitalized patients.
So what about COVID-19 transmission being airborne? So any comments on this? Because I think the WHO released a recent statement saying that it is airborne. So maybe we need a clearer explanation on how airborne it is. And then ano ba yung ibig sabihin pag airborne? Kasi dati parang ang nababanggit lang yung aerosolized, no? So what about it being airborne? What are its implications?
Mainly, it's still droplet precaution, but again, these droplets can be aerosolized if we on certain procedures like intubation, like such as intubation, nebulization. But with regards to it being airborne precaution, I'm not sure if it has already been established that it's already airborne. I think the message that we be careful, but I'm not sure if it's certainly airborne already. As far as I know, is that it's still droplet precaution and can aerosolize in other procedures.
Okay, this is a practical question, no? I think this is the second to the last question I'll ask from you. If you are exposed to a confirmed COVID positive patient, when is the best time after exposure? Should you do PCR testing knowing that there is a possibility of the patient being an asymptomatic carrier?
Okay, when it comes to exposure, the things that we should ask are number one, is the patient wearing a mask? Are you wearing a mask? Because this, from this, you will know the level of risk of you contracting the disease. So if you are exposed to this particular person, what you have, the best thing to do is you monitor for symptoms. We don't really advise immediately doing an RT-PCR or a swab test to all contacts, no? That will increase the burden. What you have to do especially for all healthcare workers, what we have to do is to monitor our temperature daily and watch out for symptoms. Anytime you have, we have very low threshold for doing swabbing on healthcare workers. Anytime you have fever, you have the symptoms related to COVID, then you should be swabbed.
Okay, thank you. So I let you rest for a while for the last question. Ito po yung huling katanungan na natin, no, para sa ating mga panelists ngayon, no. We're actually at 11:30 already. So I'd like to ask a question to everyone. Siguro just to summarize kung ano man yung mensahe natin, kasi remember, we did not really want this to be like a ranting session na nagsasabi lang tayo kung anong hindi maganda. Although of course, kailangan nating i-acknowledge yung mga kakulangan, no? Yung mga hindi natin nagugustuhan at palagay natin anong dapat nakikita. That's why we're very thankful na lahat kayo nagbigay ng inyong mga recommendations. Pero siguro maybe you can sum up your recommendations and maybe talk to the people, no? Kasi at the end of the day, kahit ano yung gusto nating gawin ng government sa atin, tayo lang din na may nakakatulong sa sarili natin. So kung yung tao mismo ay hindi willing sumunod sa tama or hindi sumunod sa kung ano man yung dapat na gawin, kahit anong support ang gawin ng government, napaka-tricky at sneaky nitong COVID-19 virus. Kasi sa ibang countries nakikita natin it's on the rise again. So baka dapat talaga sa atin manggaling yung initiative na para hindi tayo magkasakit at hindi ma-overwhelm yung ating healthcare system. So I'd like to ask this question first to Dr. Besa. Parang parting statement muna to our viewers.
So first of all po, again, on the personal level, we always have to do our part, wash our hands, wear a mask, observe all these preventive measures. But at the end of the day, while doing all these measures, I want everyone, lahat po ng nakikinig ngayon, lahat po ng Pilipino, that we must always and never fail to demand accountability from our government. Alam ko po na pwede nating sabihin na ako ginagawa ko naman yung part ko, pero yung mga iba hindi ginagawa yung part nila, so kasalanan nila, or parang at the end of the day, the government is somewhat telling us na tayo talaga yung may kasalanan, pasaway tayo mga tao. But I'd like to think otherwise na we must demand from them na they should institute measures, national measures na para makapag-respond ng maigi po sa ganitong sitwasyon. We should demand from them that they should prioritize this pandemic among over other things, over other issues. Dapat ito po talaga yung pagbigyan natin ng pansin. And as Filipinos, patuloy lang po tayo maging critical sa lahat ng mga bagay na nakikita natin, sa mga datos na dumadating sa atin, sa mga balitang natatanggap natin. Kailangan po natin na maging mapanuri at analyze all this information. At the end of the day, mag-ingay kung ano yung palagay natin na dapat na karapat-dapat sa atin bilang mga mamamayan ng Pilipinas. Because again, we Filipinos deserve a better response from our government.
Thank you, Dr. Besa. Mr. Gaba?
Yeah, I was just thinking, we always hear this saying na COVID would be around for how many months, even for next year, no? And for people who always say that, I always want to tell them na if that is what you believe in, then it will happen, no? Kasi the way I see it, how far COVID sits with us would not depend on it, but it would depend on us kasi it's not like a living organism, no? Like a thinking organism. Pero kasi it would depend on how we conduct ourselves, no? How far we comply with what is given, and what we can do, and what are the things that we are not doing. I think the extent of COVID would be still in our hands, no? Nurses, on behalf of all the nurses, we've dedicated so much since this COVID started. And since before na meron lockdown, we always relied on people to lessen the numbers by staying at home. And we've proven ourselves very effective with doing that. because they've done their part. And we thank all of those people who have complied during the past months. And we can still continue to do that moving forward if we still continue to do physical distancing, hand hygiene, very meticulous hand hygiene, cough etiquette, and of course, yung wearing ng mga mask natin, no? Those things have been going on non-stop, no? But it's a matter of doing it. It's a matter of complying. Na makita ka lang sa kanto na merong hindi gumagawa ng ganon, that's another risk of 1 case today and 5 cases tomorrow that person can infect. And that is how COVID spreads. And you would think COVID is just a virus, and that's not a person. It would always depend on us. So if we're gonna say that COVID is gonna be with us until next year, then unfortunately it's gonna be even longer if we want it to be. Because if we want it to stop right now, we have to educate ourselves and comply with what is important. Listen to healthcare providers and the experts, no? And that's true, sinabi ni Dr. Besa, no? We don't always necessarily run sa government. Sometimes that's the easiest way to do for Filipinos, but we tend to forget that we are more than capable individual Filipinos who can do something of a change than being a burden to everyone. Our medical director would always have this motto that you have to be the solution, no? And that's something that we've been imbibing everyone. If you cannot be the solution, at least you don't have to be the problem. Kung wala kang maisip na something that would help the community, at least we comply with staying at home, no? So we educate ourselves, we take care of the sick. Those who are COVID, we do not discriminate them, but we take care of them. Hopefully, one day we do not end up like being taken care of if you are careful with yourself. But those who have been inflicted, we have to take care of them. Those who are frontliners, we support them. Of course, we pray for them. And of course, you do your part. Everyone's part is very important, because at the end of the day, it's either you spread the disease or you spread the word to stop the spread of the disease. That's just my last message. And on behalf of all the nurses in the Philippines, I don't know if I can say that, no? But we've been working and have ourselves dedicated. This year was supposedly the year of the nurse and the midwife. In a different scenario, this would have been a different celebration. But we have dedicated every day of our lives for you guys, and I hope you do your part. And we thank you also for the other healthcare teams like the doctors for working with us closely. We cannot do this without you guys. And I think that's it. Thank you, Doc.
Thank you. Now for Dr. Montecillo.
Okay. So bilang isang internist at infectious diseases specialist, kami po ay nakikiusap sa lahat na makipagtulungan para sugpuin ang COVID. Sana po marinig tayo ng government natin dito sa ating health forum. So sa lahat ng frontliners, pagod na tayong lahat, pero wag tayong sumuko or mag-give up. Dapat alagaan natin ang mga healthcare workers. Hindi imposibleng tayo o ang mahal natin sa buhay ang mga ilangan ng kama sa ospital or ng ventilator. So this calls for healthcare reform for the health of our healthcare workers and most importantly for the health of the community. Thank you.
Okay, maraming salamat, Dr. Montecillo. So that ends our PCP Health Forum for this week. So this is the last Tuesday of July. For the whole month of August, we won't be having any PCP Health Forum because convention po ng Philippine College of Physicians. So see you in September. So maraming salamat po sa lahat ng ating panelists and to all those who attended, asked questions, and for to our friends in the media, maraming salamat po. And for those attending Facebook Live, see you in September. Thank you.
Thank
See you.
you.
Thank you.
Stay safe. God bless.
Thank you po. Thank you.
Thank you.